This is part 2 of my Medicare Explained 2-part video series as updated for 2025 and 2026. If you have not seen part 1 of this Medicare Explained series, please click on the link above my left shoulder to view that video first. In part 1, I discussed original Medicare and what it covers, plus described some of the pros and cons of Medicare Advantage plans. In this video, I will go over the pros and cons of Medicare Supplement plans, how to choose between an Advantage plan and a Supplement plan, including the demographics, who usually chooses one plan over the other. That will be followed by an important look into how both Advantage plans and Supplement plans will adjust for inflation over time. That is important because you must plan on having your Medicare for another 25 or 30 years. Lastly, I will wrap this series up with a few words of advice as I share with you some tips based on my experience helping thousands of people choose the right Medicare plan for their needs and their budget. So here somewhere is a table of contents for this Medicare Explained Part 2 video. Before I get started, if you haven't yet, please like this video and subscribe to my channel so that you have access to all of my Medicare videos, including a lot of upcoming videos. So thank you in advance. Now, let's get started with the pros and cons of a Medicare Supplement plan. What exactly is a Medicare Supplement plan? A Medicare Supplement plan is a private insurance designed to work hand in glove with original Medicare as secondary insurance to your Medicare. Original Medicare is primary. That means Medicare sets the rules for the supplement to follow. The supplement is secondary insurance. It's like a dummy insurance policy. It has no say in your coverage. When Medicare pays its portion of the bill, it instructs the supplement company on what to pay and to whom. The supplement has no choice but to do as Medicare instructs. The supplement is not involved in the decision-making process for your health care. Because a Medicare supplement is secondary to your original Medicare, you get to keep the two greatest benefits of original Medicare. You can see any medical provider in the United States or its territories as long as they accept Medicare. Plus, no insurance company has a say in your health care. Your medical decisions are made between you and your doctor. The communication between Medicare and the Medicare supplement is all done electronically through most of the major insurance companies, which is why, according to most major insurance companies, 85 to 90% of the Medicare bills sent to the supplement company are paid within 48 hours without human intervention. To be clear, a supplement does not increase the types of procedures covered by Medicare. It pays the deductibles and copays that Medicare does not pay, reducing your financial risk and your financial outlay for Medicare procedures. In fact, you can lower your annual risk for Medicare bills down to just a few $100s per year. The supplement policy pays the financial gaps in Medicare so that you have a very limited exposure to medical bills, and that is why they're also called medigap plans. They pay the gap. So how many Medicare supplement plans are there? Now, you might recall in the Part 1 video that I mentioned there were well over 3,000 different Medicare Advantage plans across the country. Well, there are only 10 Medicare supplement plans. Where a Medicare Advantage plan is only local coverage, every Medicare supplement policy offers insurance coverage in all states and U.S. territories. It offers insurance coverage wherever Medicare has insurance coverage. And that means if you move from one state to another, you do not need to change your supplement. If you like to travel in an RV, you have the same insurance coverage everywhere you go in the United States. Also, unlike Advantage plans, the supplement plan benefits are standardized. In fact, the benefits are defined and written into Social Security law. This means the benefits do not change from one insurance company to the other, or from one year to the other. Significant difference between the supplement plans and Advantage plans. In addition, even after your 180-day Medicare supplement initial enrollment period, You can change Medicare Supplement plans any day of the year, 365 days a year, but you may be required to be qualified medically to do so. Let's look at an example to help you understand how the supplement will work with your Medicare. On the left side of your screen is the 2024 Medicare Part A benefits, illustrating the deductible and coinsurance that the consumer will pay. On the right side of your screen are the Medicare Supplement plans and the benefits they pay. Let's start with the Part A inpatient deductible. Now, this is a per event deductible. It resets whenever you are out of the hospital for 60 days. For 2024, it's $1,632. Now, let's look at the Medicare Supplement Plan's benefits for 2024. The benefits are listed in the left-hand column, and then the Medicare Supplement Plan names are across the top. The plans are named by letter: Supplement Plan A, Supplement Plan B, etc. The Medicare Part A deductible benefits 3/4 down the page. Medicare Supplement Plan A does not pay a benefit towards the Medicare Part A deductible. Notice that section is blank. That means this particular supplement does not cover this benefit. However, all of the other plans pay 100% of the Part A deductible, with the exceptions of Plan K, Plan L, and Plan M. Now, let's go back to the left and notice that with Medicare Part A inpatient care, you will pay a $408 per day copay or coinsurance for days 61 through 90, and then $816 per day up to day 150. And after day 150, you pay all the costs. Okay, that seems a bit harsh. But let's look at the supplement benefits. The very top left box says Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up. Notice that every single supplement pays 100%. That means if you have a supplement plan that pays 100% of the deductible, you can be in the hospital for over a year and not pay a dime in Medicare inpatient charges. Between Medicare and the supplement, inpatient charges will be paid for. These documents are available in the show notes below and on my website, MedigapSeminars.org, under the Resources tab. You may also want to look at the Part B outpatient benefits. Now, two very important features of all Medicare supplement plans is that, one, they have a monthly premium. You will pay extra for the Medicare supplement. Now, the premiums vary greatly from one insurance company to another and from one state to another state, and often even by age or gender. The second is that you only have a short period of time where you can enroll in a Medicare supplement plan without the need to meet health requirements. You have a 180-day period from the day that your Medicare Part B outpatient coverage starts, where you can apply for any Medicare supplement plan available to you that cannot ask you about your health history. After that 180-day period, the insurance company is allowed to review your health history, and if there's a history of critical or chronic illness or other costly medical expectations, they can deny your application. That process is called medical underwriting. Some states have state rules that are an exception to this national rule, and talk to us if you have questions on that. Of course, I have a video titled, "Can You Pass Medicare Underwriting?" if you wish more details on that process. So it's linked above and in the show notes below. According to the latest survey by GenRE, 75% of all Medicare supplement plans purchased today are either Plan G or Plan N. If you're not sure which is right for you, I encourage you to view a detailed comparison in the video linked above my left shoulder titled Plan G or N, How to Choose a Medicare Supplement. What we will cover next is what you should consider when comparing Advantage plans to supplements and choosing a health plan for the rest of your life. So now you have a good idea from these, having watched both Part 1 and so far in Part 2, you should have a good idea of the differences between Advantage plans and supplements. So how is it that you can make a permanent mistake? I believe the potential for a permanent mistake can best be described by providing two examples, and these are, sadly, a very common occurrence. Both of them are. One common mistake is when a person enrolls in Medicare Part B while still working and receiving employer-sponsored health insurance. Then, sometime later, they develop health issues like a heart attack or a stroke. Their insurance coverage of Medicare combined with the employer group plan is fine. That works just fine. But then they decide to retire, which means canceling their employer-sponsored group health plan. Their group health plan ends and they want a Medicare supplement to combine with their original Medicare. Well, because they've had their Part B for more than 180 days, they must qualify medically for a supplement, but they can't qualify because of their history of critical or chronic illness. They no longer have a choice. They cannot get a Medicare supplement plan. They've forfeited one of the three options that were originally available to them. They can get an Advantage plan because Advantage plans don't have any health requirements, or they can just stay with original Medicare. That's it. A second common mistake is when a person decides to start their Medicare with an Advantage plan. Often because of the low premium, they think they'll save money, and because their health, is good, and they figure, well, they can change to a supplement later or at any time. Of course, and then they get an autoimmune disease or have a cardiac event, and so on. Just as in the previous example, a Medicare supplement is no longer an option because of their health history. The permanent mistake in both cases is that they forfeited their ability to get a supplement. Of course, they can still get an Advantage plan because Advantage plans have no health requirements. My advice is to always get today the health insurance that you will want to have when you are sick or injured. Don't try to time your coverage like a stock trade. I've seen people attempt that. When it doesn't work, the cost of the mistake is permanent. It's like going all in poker, and you might win on a few hands, but when you lose big. For the last section of this video, I will discuss what to expect in the long term. How do original Medicare and Advantage plans and supplement plans account for inflation, rising costs over the long term? This is important as you plan for what to expect from your health care in 20, 25, or 30 years from now that you will have your Medicare. Then I'll touch on briefly who usually chooses Advantage plans or supplement plans or why. So let's look at original Medicare first. So what can change over time? Original Medicare benefits cannot change without legislation passed by Congress and signed by the President. That's good because no politician wants to commit a political suicide by messing with Medicare. What does change with original Medicare is the Part B premium, deductibles, copays, coinsurance, and the same with Part A. Those will increase over time. For example, the current Medicare Part B premium is $174.70 a month. It's 2024. So Medicare's official estimate is for that monthly premium to reach $299.80 by 2033. The current Part B annual deductible is $240. Medicare official estimates expect that Part B deductible to reach $421 by 2033. Lastly, the current Medicare Part A inpatient deductible is $1,632. It's for 2024. Medicare estimates that Part A deductible will reach $2,236 by 2033. So that is how original Medicare adjusts for inflation. It increases the premium for Part B and then the deductibles, copays, and coinsurance for both parts. Medicare Advantage plans have three ways that they can adjust for inflation. First, and least likely way to adjust for inflation is by increasing the monthly premium. And increasing premium is possible, but I believe the other two methods of adjusting for inflation are more likely because the low premium for an Advantage plan is critical to its demand. It's what makes people attracted to Medicare Advantage plans. The second way to adjust for inflation is by increasing the consumer's maximum out-of-pocket risk. For 2024, your maximum financial out-of-pocket is at $8,850 a year for in-network services. For 2025, that's increasing by 5.5% to $9,333. That's your maximum potential risk. If it continues to increase at this rate, your maximum annual out-of-pocket for a Medicare Advantage plan will be at $20,000 in 15 years. That's a lot of money to be at risk for out-of-pocket. The third way the Advantage plan adjusts for inflation over time is by increasing the co-insurance and co-pays that you have to pay for your medical services. Some plans also include deductibles that will increase. But in this case, if all of those co-pays, deductibles, etc. increase, even if you don't have expenses that reach the maximum out-of-pocket, you're still going to have more money out of pocket because you're paying the higher deductibles and co-pays, etc. with your Advantage plan over time. In short, Medicare Advantage plans adjust for inflation by reducing your benefits and increasing your cost for medical services. So how do Medicare Supplement plans account for inflation over time? The answer to that is much simpler, but just as painful. Medicare Supplement plans can't change their benefits, just like original Medicare can't. They can only change their costs, their monthly premium. If you purchase a Medicare Supplement plan, you can expect the monthly premium to increase over time. I believe a doubling of the premium over 15 years should be planned for in your budget. What this next comment I have to say is very important to understand about Medicare Supplement plans and their cost. For a Medicare Supplement, the rate of premium increases is impacted most by the insurance company you choose, not the plan you choose. And that's what we help with. The second greatest impact on your premium will be the specific Medicare Supplement plan you choose. The rule of thumb is that the more benefits a supplement plan offers, the more it's susceptible to inflation. Plan G, for example, has more benefits than a Plan N, so you should expect a higher percentage rate increase from Plan G over time relative to the Plan N. That said, there are 3 Medicare Supplement plans that are most susceptible to inflation and an exception to the rule of thumb that I just mentioned. Those are the high deductible plan options offered for Plan G or F, and then Supplement Plan K and Supplement Plan L. The high deductible plans are susceptible to inflation because your deductible increases each year at the same rate as the published Consumer Price Index. Medicare Supplement plans K and L are susceptible to inflation because they only cover a portion of the gap in coverage left by original Medicare. Thus, as original Medicare adjusts for inflation, the benefits of a Medicare Supplement plan K and L are reduced. All right, if you're still with me, I congratulate you. We have been over a lot of information on Medicare, Medicare Advantage plans, and Medicare Supplement plans through these 2 Medicare Explained videos. I would argue that by now you are already the smartest person in the room when it comes to Medicare, especially if you're watching these videos alone. Okay, that was a bad joke. There's just one more piece of information that we need to add to put all of this together that will also boost your confidence in whichever decision you make. That information is one of demographics. Who typically chooses Medicare Advantage plans and why, and who typically chooses a Medicare Supplement plan and why. I did an entire video on this subject not too long ago titled Medicare Explained: The Secrets of Who and Why, linked above and in the show notes. So I'm just going to touch on it, but I think it's great information that if you want to dive further into this, it can really be eye-opening. Medicare Advantage plans have grown in popularity in recent years to be just as popular as Medicare Supplement plans. But you just went through a couple videos that detail how they're inferior insurance coverage. So why would people choose them? In short, money. For individuals, it's because Medicare Advantage plans have either no monthly premium or very low monthly premium. In recent years, we've seen a type of Medicare Advantage plan called a Dual Special Needs Plan, or DSNP, become increasingly popular for Advantage plans. These are plans designed specifically to improve the health care of people who qualify for both Medicare and Medicaid. Medicaid is government assistance for low-income people. Studies by the Kaiser Family Foundation and by eHealth show that more than 70% of the individuals on an Advantage plan do not have enough discretionary income at the end of the month to pay for a Medicare supplement. They simply cannot afford the Medicare supplement option. In addition, we've seen Medicare Advantage plan insurance companies approach very large corporations and pitch the idea of creating a Medicare Advantage plan for their retirees. So instead of a retirement health care being an expense to the corporation, it becomes a source of income for the corporation. The corporation is bonused on the sale of the group Medicare Advantage plans. It's always about money. In these cases, the large company uses the trust that their employees have in them to pitch the Advantage plan option, and will sometimes tie a monthly retirement stipend to the purchase of the Advantage plan. So these two markets is where the growth in Medicare Advantage plans has come from. Medicare Supplement plans remain the favorite choice for those who have the budget for the monthly premium, and especially those who research their Medicare options, as you have been in these videos. We also found that supplement plans are the insurance of choice for those who have spent their careers in the medical community as a medical provider, a medical billers, caretakers, and so on. They've seen the difference in care that people receive who have original Medicare and a supplement over that compared with an Advantage plan. So demographically, where do you fit in? Let me know in the comments below. But let's wrap all of this up with a few words of wisdom, so to speak, coming from a person who has helped tens of thousands of people with their Medicare and who's now on Medicare himself, if I may be so bold. In retirement, the importance of the quality of your health care is second only to your health. Your health care has a direct impact on your health, which has a direct influence on the quality of life in retirement. So your health care is an important decision. In these videos, I've stressed that you should get today the health insurance that you will want to have when you are sick or injured. Don't try to cut corners to save money. It's not worth it, and I have seen so many people take that risk with their insurance and lose that honestly over the years I've lost count. If you're unsure, I suggest starting with a supplement plan that fits your budget. If you need to change to an Advantage plan in the future, you can do so from October 15th to December 7th of any year for a January 1 start date. If you get an Advantage plan, you'll want to use a person who not only has experience with Advantage plans, but also the resources, the back office that you need if you ever need to appeal a denial of service. The one-man shop doesn't have necessarily that for you, doesn't have the resources, simply because their entire operation has to come to a standstill to help with a problem that the agent may not really know how or be trained on how to fix. You want someone with a team of experts that can help you when you need. And of course, that is how I designed my company. If you get a Medicare supplement, understand that over the long run, your choice of insurance company is more important than your choice of supplement plan. Again, that is what we advise on. But this is a changing environment. Price increases and insurance company pricing strategies have changed significantly since 2020. So you want someone who will continue to monitor your insurance company and the competitive landscape and to keep you informed and advise on if or when you need to make a change. I and my team monitor every client and reach out whenever we see something like an unusual price increase that has me concerned. So I hope that you found the information that I've shared with you worth the time that we have spent together. Your Medicare is an important decision, and I'm here for you to help you along the way. So please reach out to me and my team at Medigap Seminars. We're experts at guiding you through the Medicare decision from your decision process onto the cares and the issues that have as you use your Medicare over the years. Please like and subscribe to this video so you can easily find all of my Medicare videos and be alerted when I publish something new. And also let me know if you prefer a two-part video series like we've done here or just one long video that lasts almost an hour. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.